Hi, my name is Terza, and I just want to thank all of you for taking the time to listen to us and hear kind of, I guess, our journey and our story just as the patient. I was diagnosed when I was 36, so it was in June of 2022, and I found a lump in my breast. I actually found it in August of 2021. And at the time I was working for a plastic surgeon, so she sent me for an ultrasound, and it just showed as a benign tumor. They said just repeat it in 6 months, so I did, and it was the same again, just a benign tumor. But then a couple of months later, it just doubled in size, like I could see it protruding through my skin. So I went for another ultrasound, and that's when they said it looked like cancer. So I did have the biopsy, and then I found out that it was ER positive, PR positive, and HER2 negative. So obviously this took me just kind of by surprise. Working for a plastic surgeon who had a lot of breast cancer reconstruction patients, I was really aware of all the signs and symptoms, what to look for. I had 2 children, I was healthy, so it just, when you find out like you do have a diagnosis like this, it just, your whole world just kind of closes in on you. So everything just happens so quickly, there's so much information. I got my oncology appointment, and I think what I kind of wanted to share was, when you find out that you have cancer and you get your oncology appointment, it's kind of the only thing that you are thinking about. It's circled on your calendar. Your whole world kind of just revolves around that one appointment and what they're going to say to you. And I know for, physicians, like when you look at your schedule, it's just another name on the sheet, but for us, it is our whole world is coming to that appointment, what we're going to hear, what you're going to say to us. And in that moment, you already have so much going through your head and how your life's going to change. I decided to do the neoadjuvant chemo, so I did 4 treatments of the AC and then 12 rounds of the Taxol. So it was a total of 5 months of chemo, and then followed by that, I did a double mastectomy with reconstruction. So here I am, like on the other side of it, and I am not the same person that I was before cancer, and I don't think anyone is. And you kind of just take a look at your life, and you make some huge changes. I've changed kind of just the people that I'm around. I changed careers, and I'm just very grateful that I did have such a good team of doctors. But the long-term side effects of life after cancer, I think, are what people don't really talk about. And the whole focus when you talk to your oncologist and your general surgeon is just to get rid of the cancer. And I understand that that's what your job is to just make sure that the cancer is gone, it's not coming back, we hit it with everything we can, we do the surgeries. But I think there's such a huge part in all the other things that maybe go a little bit missed or just are forgotten about, because it does change your whole world, and it changes your relationship. It changes, even just for me, being put in menopause, it affects your sex life. It affects how you feel about yourself. It affects like the daily things that you used to be able to do and you can't do anymore. I had a really hard time with the hormone suppressants, and I tried many different things. I was doing the Zoladex injections, and that wasn't working for me, just because it has to be injected into your fat, and I don't really have a lot of fat in my stomach area, so it was so painful. So we switched to Lupron injections, and then I did daily pills of anastrozole, and honestly, like, it crippled me. I had such a bad reaction to the hormone suppressants that my quality of life was gone. And for me, it was a personal choice to stop doing the hormone suppressant therapy because the risk versus my quality of life just wasn't worth it. And I think that is also something that maybe needs to be taken into consideration a little bit. Is the goal is to make your risk of the recurrence zero, but the quality of life is also so important. And for me, as you know, a 37-year-old mom of 2, I'm engaged, I have such a full life ahead of me. For me, it wasn't worth the risk. So just things like that to kind of keep in mind. And your patients are going through so much, and just to kind of maybe have those talks about risk versus quality of life, because I think it is really, really important. Another thing I thought was important for me in my personal treatment was just being positive. And sometimes I think it's hard as doctors, you come in and you want to give us all the facts and you want to tell us about the trials and you know, your percentage of survival rates and things like that, whereas you can Google that. And for me, I didn't want to come to an appointment and hear my 5-year survival rate on a stat, because for me, I don't think like that, and I don't have my mindset like that. So sometimes I think it's also really important to just kind of be really positive, and then to celebrate the wins and the little wins. You know, even when your pathology comes back clear, like, it should be a celebration. And I am so fortunate to have Dr. Manna as my oncologist, and she shows up for her patients and goes above and beyond, even just showing up to the CIBC Run for the Cure. Like, when she shows up every year, it does show that she actually really cares, and she wants to see the side of things outside of the cancer center. And I think that's just so important. But yeah, cancer changes you, and it does affect your life forever. And so even though I'm not in current treatment anymore, it's something that I think of every day, and probably will for the rest of my life, because you're constantly thinking about recurrence or paying attention to, like, what little pain was that I just felt. So it doesn't ever go away. And I do grieve the person that I once was. And it does feel like once you get a cancer diagnosis, that part of you dies in a way, and you become a different person. So I just kind of wanted to give my personal experience, and yeah, I'll let Joanne tell her story.
So I'd like to thank everyone for listening to their stories, and I hope, as I said, we can all walk away with some important information. So sorry.